In this video, we will learn about the lab diagnosis of an important virus, that is Hepatitis B virus. Hepatitis B virus is a partially double-stranded DNA virus. Its family is Hepatnaviridae. It is an enveloped virus and its diameter is 42 nanometer. Its enveloped virion is called Dane particle after the name of the scientist that discovered it. Its symmetry is icosahedral. In the structure of hepatitis B virus, there is an outer lipid envelope that contains an important antigen, that is hepatitis B surface antigen. In its inner core, there is hepatitis B DNA genome, DNA-dependent DNA polymerase enzyme that is required for its replication, and two other important antigens, that are core antigen and envelope antigen. Now we will discuss all the important antigens or markers that is present in this virus. First most important marker is hepatitis surface antigen. That is the first marker to appear in the blood, and it is detected in the blood even before the onset of illness, that is the incubation period. It disappears after 5 to 6 months of exposure. It is present only in the acute infection. Next is the antibody to surface antigen that appears in the blood after 2 months of exposure and then persists afterward. It is important diagnostic factor because it indicates its presence only. If it's present alone, it indicates vaccination status. Next is core antigen that forms the nucleocapsid core of the virion. It is not demonstrable in the blood. Antibody to core antigen is important, that appears after 2 months of exposure and then persists afterward. It is the earliest antibody marker that is seen in the blood. It is the only antibody that is present in the window period. It is the marker that is present in all the phases, including acute phase, window phase, recovery phase, and the chronic phase. Next important antigen is envelope antigen that appears concurrently with the surface antigen. It is secreted from the infected cells into the blood. It is an indicator of active intrahepatic replication, and it indicates a period of high infectivity. Antibody to envelope antigen appears 5 to 6 months after exposure and then persists afterward. Its level may or may not fall down in case of complete recovery and chronic carrier state. Now we will discuss the serological findings in case of acute infection of hepatitis in this graphical form, in which this in this graph the red curve is indicating the hepatitis surface antigen that appears 1 month after exposure and then it disappears after 5 to 6 months of exposure, and its antibody appears, that is indicated by this yellow line. It appears after 5 to 6 months of exposure and then it persists afterwards. Then this pink line indicate envelope antigen that appears concurrently with the surface antigen, but its level or titer are low as compared to surface antigen. It disappears after 4 months of exposure and indicate a period of high infectivity, and its antibody, that is indicated by this green line, appears after 5 to 6 months of exposure and then it persists afterward, and its level may fall down in case of complete recovery or chronic state. And then this blue line is indicating the antibody to core antigen that appears 2 months after exposure and then its level rise and then persists afterwards. Here again there is a tabulated form of the results of hepatitis B viral infection. In this case acute disease. In case of acute disease, Hepatitis surface antigen would be present, envelope antigen would be present, the two important antigens of hepatitis virus, but the core antigen would not be detected in the blood. Its antibody would be present in case of acute infection. In the window period, the only detectable marker is antibody to core antigen. In the complete recovery phase, antigen to surface antigen would be disappeared and its antibody would be present. Antibody to core antigen would be present and antibody to envelope antigen may or may not be present. In case of chronic carrier state, surface antigen would be present, its antibody would not be present, antibody to core antigen would be present, and antibody to envelope antigen may or may not be present, as we discussed earlier. In case of vaccination, the only marker that would be present in the blood and detected in the blood would be antibody to surface antigen. Now again we will see what are the important diagnostic markers or tests during various stages of hepatitis B in another tabulated form. In case of susceptible stage, there would be no marker present in the blood, and when the patient is immune due to its natural infection, antibody to core antigen would be present and antibody to surface antigen would be present. The two antibodies would be present and surface antigen would be negative. And when the patient is immune due to vaccination, only antibody to surface antigen would be present. This is the difference in the two states when the patient is immune due to natural infection and in case of vaccination. In case of vaccination, only antibody to core antigen would be present, as we discussed earlier. In case of acute infection, hepatitis surface antigen would be present, envelope antigen could be present in case of high infectivity period, and antibody to core antigen can be present, and this antibody would be IgM antibody, and antibody to surface antigen would not be present. In case of chronic infection, surface antigen would be present and antibody to core antigen would be present, and antibody to surface antigen would not be present, and antibody to core antigen would be IgG antibody in case of chronic infection. And in the last point, when only antibody to core antigen is present, its interpretation can be the patient can be in the resolved infection phase, the test can be false positive, or there can be low level of chronic infection or resolving acute infection. So this was all about the lab diagnosis of hepatitis B virus.